Hi, my name is Erin Early, and this is my presentation on panic disorder. Panic disorder falls under the umbrella of an anxiety disorder. It is a recurrent and unexpected panic attacks. They would include a physical reaction along with a cognitive reaction. This would be defined by a physical reaction of four of the following: palpitations, pounding heart or accelerated heart rate, sweating, shaking, or trembling sensations of shortness of breath, smothering, feelings of choking, chest pain, discomfort, nausea, abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, having chills or heat sensation, paresthesia, derealization or depersonalization, fear of losing control, or fear of dying. When the individual feels this, it's usually the onset is within 1 minute. The feelings are intense fear, and the attack generally is instantaneous. This is followed by 1 month of persistent concern or worry about additional panic attacks or consequences from the panic attack, or the maladaptive behaviors related to the panic attack that had happened previously, like avoidance of the area of the previous panic attack, or behaviors, unfamiliar situations that may relate to the previous panic attack. These behaviors then become indicative of disturbances in life interactions, work disturbances, family life interactions, social situations. This is what qualifies it to be a disorder. The physiological processes of a panic disorder, therefore, is the amygdala is believed to be the central part of the brain that is involved in the disorder. The amygdala is often referred to the brain's fear center. This is crucial. It is the crucial role in processing and responding to fear and anxiety. The amygdala is involved in fear conditioning, which is the process by which we learn to associate neutral stimulus with a fearful event. This is why certain triggers can cause intense fear responses in individuals with panic disorder. It helps process and interpret emotional stimuli, particularly those related to fear and threat. This heightened sensitivity can lead to the exaggerated fear responses seen in panic attacks. Additional neurobiological mechanisms that the amygdala is involved in is hyperactive. Individuals with panic disorder have overactive fear response in the absence of real danger. The amygdala is part of a larger neural network that includes other brain regions, including the prefrontal cortex and the hippocampus. So dysregulation in these pathways can contribute to the development and maintenance of panic disorder. The functional MRI studies have shown increased amygdala activation in response to fear-inducing stimuli in individuals with panic disorder. Additionally, the periaqueductal gray region of the midbrain is involved with the defense response. So it is also involved in panic disorders. This would also include other areas such as the thalamus, hypothalamus, brainstem, peribrachial nucleus, and the locus coeruleus. Additionally, the sympathetic and parasympathetic nervous systems play a vital role in the panic disorder. Sympathetic nervous system obviously involves the fight or flight response. The sympathetic nervous system helps with the activation of adrenaline, which increases the heart rate and breathing, and the tensing of muscles to respond to a fearful or harmful situation. The parasympathetic nervous system which is called the rest and digest, deactivates the sympathetic response. These two counteract each other, and when panic disorder happens, there is a counteracting response with both of these that are also involved with the amygdala. Neurotransmitters and hormones also play a vital role. The preganglionic and postganglionic sympathetic neurons, which are also associated with the sympathetic nervous system. These are adrenaline associated neurotransmitters. Serotonin, norepinephrine, dopamine, and GABA neurotransmitters are all associated with maladaptive behaviors and triggers with panic disorder. The fight, flight, freeze response, this again focuses on the amygdala. It plays a crucial role in flight, fight, or freeze response in humans. When faced with a challenge, fear, or threat, the amygdala and the human nervous system send signals activating the sympathetic nervous system into action. The system is responsible for the response that is necessary for a threat or fear situation. When the perceived threat or fear has passed, the parasympathetic nervous system takes over. It sends in new neurotransmitters with different hormones to calm the physical response to the threat and return the body to a normal state. With panic disorder, this is activated when it doesn't necessarily need to be activated. The perceived threat isn't actually a threat. Research on the causes of panic disorder. Research has shown that there could be a chemical imbalance of neurotransmitters. This research has shown that there could be, we'll get into this, but SSRIs are very helpful for this particular piece. We're producing too much of the serotonin, and it's hyperactive to our panic and causing us to overreact in situations that is unnecessary. And so to help control that chemical imbalance, we have the psychopharmaceuticals to be able to help with that chemical imbalance. There's also damage to the relay stations, the neurotransmitters, and then possible hereditary connections. Also, cognitive behavioral theories, stress, and misinterpretation of sensory information can cause catastrophic thinking patterns. One of the comorbidities is post-traumatic stress disorder. We're going to talk about that in just a minute. When there is trauma involved, it does reorganize the neural pathways, which means we can trigger a panic attack when it should not happen. When we are faced with something that triggers the fight or flight response that was overreactive to a trauma response, a panic attack can happen when it shouldn't normally happen. The comorbidities of panic disorder. Anxiety disorder is one of the big ones because it falls under the same umbrella. When we are anxious of other situations, anxiety kicks in and we're already sending too many of the neurotransmitters in the wrong direction. And a panic attack can happen much more easily. We send the wrong signals and it goes hand in hand. Major depressive disorder is another comorbidity, and bipolar disorder is another comorbidity with panic disorder. In the more heightened state of awareness with bipolar, when we're up in the bipolar phase. Post-traumatic stress disorder is another one. When we've been through a trauma, we're already in a heightened sense of awareness. Anything that is associated with the trauma is going to be an activation for our trauma response. We are reliving that that event, which triggers our sympathetic nervous system to be ready to fight or flight or freeze. And the panic can set in, setting off that alarm system once again, and a panic within a minute can happen and send those signals, overreacting. So it is another comorbidity with panic disorder. Evidence-based treatments options. Cognitive behavioral therapy has been one of the most scientifically proven. This can include trauma-informed cognitive behavioral therapy. It can be used with cognitive challenging, cognitive reframing, grounding, and deep breathing exercises to make sure that that the individual is where they need to be able to face whatever brought on the panic, and to be able to be in the space to be able to process the panic attack, and especially when the month following, with the persistent concern and worry about the panic attack happening again, we're able to cognitively challenge those thought processes and be able to help the individual rethink their thoughts and challenge the panic attack through treatment plans. Exposure therapy, gradual exposure to the panic, to the event, to the trigger, to the activation, but gradually and with the help of the therapist. Psychopharmaceuticals are also a good choice. The first choice is the SSRI, selective serotonin reuptake inhibitors. Again, that goes back to the the chemical imbalance within the neurobiological processes. And then one of the best treatments is to do both for panic disorders. The research has shown that using both methods gives the best chance for recovery from a panic disorder. One thing that research has yet to really dig into is the cultural background for both. Cognitive behavioral therapy has scientifically been proven to fit into multiple cultural backgrounds, but psychopharmaceuticals has yet to show that it has done enough research to help on all cultural backgrounds. But the evidence has been shown that it is both, for most cultural backgrounds, that it is best to have both. Treatment plans include cognitive behavioral therapy and psychopharmaceuticals as part of the treatment plan.